Hey, boss. So it's like about 1:30 a.m. and guess who decided to study? Me. Like, what? So basically, I can't sleep. And I've been awake like since like 12. And that's because when I came back from school, I was super tired. So I decided to study, but I was still super tired. So I then like slept off. So that was like around 8. So I woke up around 12 and I couldn't sleep back. And I was like, okay, let me study, right? So I decided that I don't want to study alone and I wanted you to like join me. So that is why I'm making this quick study with me video. So if you're interested, you definitely need to keep on watching. Right now, what I'm going to be studying is urinary tract infection in pregnancy. As you can see, this is urinary tract infection in pregnancy, and I'll be studying this with my tab because it's just basically like a short study session. I think it's going to take me about like 30 minutes to 1 hour to finish this material. So that is why I just want you to join me. So let's begin. It's going to be a quite nice one. Yeah, let's do this. So you're gonna stop seeing my face for like a while and see my books. Then occasionally I'm gonna explain what I've read so we can make it more interesting and interactive, okay? All right, so as you can see, this is urinary tract infection in pregnancy by Dr. Anozie. Introduction. Okay, guys, so I just finished reading my urinary tract infection in pregnancy, and that took me about like 35 minutes ish because I started studying by 1:40 and I finished by 2:27. Yeah, so let's drink some water first. That was a quite nice. So I read urinary tract infection in pregnancy, and the whole material first started with what is urinary tract infection. Basically, there are three main types, which we have the asymptomatic bacteriuria, we have the acute cystitis, and we have the acute pyelonephritis. That are the three most common urinary tract infection that you can find in pregnancy. And after that, we went further to discuss what is true bacteriuria. Now, true bacteriuria simply means when you have greater than 100,000 bacteria, right, of the same species or colony in, I think, in 1 mil per urine collected through the urine is collected through clean catch. That means the urine collected is ensured that it's not contaminated. So this uncontaminated urine collected, right, has greater than 100,000 bacteria, and this shows that someone has bacteriuria. Okay, so basically that's what I learned. Then also we were able to discuss the I think conditions, right, or risk factors for women that should have UTI in pregnancy. I saw women of low socioeconomic status, right? Also, women who have advanced age. Women that have sickle cell anemia or sickle cell trait are also very likely to have urinary tract infection in pregnancy. Women with diabetes and other chronic diseases, these are the most common conditions that can make women to have it. Now, urinary tract infection is also very common. About 3% of women always have this, and 99, right? I think, yeah, about 40%, 99 women. There was a study that was done in the material that showed that a large number of women are likely to have bacteria in their urine, right? Especially pregnant women, because women have this short urethra, right? So because of the short urethra and the close proximity to to the vagina, right, it's more likely for it to be contaminated. So women that have poor hygiene are also likely to have urinary tract infection in pregnancy. Now, one of the things that also caught my attention, if I can remember correctly, is the pathophysiology. Now, the pathophysiology of urinary tract infection in pregnancy is that the progesterone that is released, that is a hormone that is released during pregnancy. Now, this hormone basically causes like dilation of the urethra. Now, there's a little bit of confusion. Now, if you look at the bladder, I think I'm just gonna draw a little here. Now, let me draw the bladder for you, right? Don't mind my drawing, right? Now, if you look at the bladder, now this bladder, as you can see, this upper part is called the ureter, and this is called the urethra. Okay, so the ureter and the urethra. Now, a lot of medical students can confuse the ureter for the urethra. Now, but all you need to know is that the ureter, which is the one that's up, gets dilated by this hormone called progesterone during pregnancy. And once these guys are dilated, it kind of like, there's no, normally it's constricted so that it can prevent backflow of urine. Now, when it's dilated, there's easy backflow of urine. And not just that, the uterus, which dextro rotates, now compresses on the bladder. All right. Now, it's not enough that women have a short ureter and we get to like urinate often. Now, we have to also face the fact that when we're pregnant, or if you decide to get pregnant, your uterus would compress, right, on the bladder. Now, this compression will also cause what we call a vesico-urethral reflux. Now, it's compressing, which is increasing the pressure on the bladder. And now the ureters are dilated because of progesterone. There would be a vesico-urethral reflux. That means urine from the bladder can now return back into the ureters, right, to the kidney. This will cause hydronephrosis, can cause acute pyelonephritis, and these are the conditions that will now cause urinary tract infections in pregnancy. So this is a very simple explanation of the pathophysiology and of what I've learned. I was quite excited. It was really nice, like about 35 minutes studying, and thank you for joining me in this study session. If you like videos of me studying and giving a brief explanation of what I read, please give this video a thumbs up and tell me in the comment section, and I'll see you in the next video.